overhead images for the single contrast barium enema. Oftentimes the protocol is the AP, both obliques, the rectosigmoid AP axial or PA axial, and then the lateral rectum. Some radiologists will do the lateral rectum image with the fluoroscopy unit, so you may not have to do that projection. For the AP, use a 14 by 17. Okay, center at the crest, and then be mid-sagittal. And I'm using my right marker to indicate this is the right side of the body. So after you shoot that image, change out your cassettes, and then the RPO. I'm going to mark with the right marker since I'm doing the right oblique, and make sure that you mark the right side. Turn the patient 35 to 45 degrees. Okay, palpate the crest, and then that's where your transverse line will be. And then find the midline of the patient, and your longitudinal line is going to be 1 to 2 inches up. Okay, so this is our RPO. After you shoot that projection, then we'll do the LPO. Use your left marker, put it to the left side of the cassette or to the left side of the patient. Okay, roll your patient 35 to 45 to the left. Of course, if your patient is able to move real well, they can actually turn, and you do not have to use the positioning sponge. Find the crest, find the midline, come up 1 to 2 inches for the longitudinal line. That is our LPO. Now, since the patient doesn't turn over prone, I'm going to do the AP axial for the rectosigmoid. So I'm going to lay the patient back supine. Tube angle is going to be 30 to 40 degrees cephalic. Always line this up with the bucket tray. Okay, I'm going to palpate the crest, then the ASIS, and then 2 inches below that is where our transverse line is going to be. So that is where you want to be, transverse line, and then you'll be mid-sagittal. Okay, so this is the AP axial. Okay, and if you need to do the lateral rectum, you'll use the 10 by 12 inch image receptor. Patient's going to be on the left side. Use your left marker. Will be a vertical beam. And I'll have the patient roll all the way up onto the left side. Okay. So make sure your patient's lateral. And this is a 10 by 12 inch image receptor, so your collimation will be for the 10 by 12. Now, I'm at the level of the crest with my fingers, but once you palpate that ASIS, your transverse line will be right at the ASIS. Longitudinal line will be at the mid-coronal level. Okay, and then this is our lateral rectum. Now, once you've checked all of your images, then you can let the barium go back into the bag. You can unclamp it, and the patient can lay on their side for a few minutes while the excess barium runs into the bag. This will make it a lot easier for the patient to get up and go to the restroom if they have the majority of the barium back into the bag.